Dr. B, can you help me? Dr. B, can you help me?
In this episode of Dr. B, Can You Help Me? I'm going to be explaining a little bit about how the hip can contribute to low back pain. Certain areas of our body are meant to be very mobile. You think about your ball and socket joints, your shoulder, your hip, your upper back has to be very mobile in the golf swing, your neck, your ankle. So I see a lot of golfers who come to me with low back pain, but I assess their hip rotation and it's horrendous. They had no hip rotation at all. That is going to cause pain in your low back. It's the root cause of the problem. It's not where the pain is manifesting, okay? You may have it in your low back, but I guarantee you if your hips are stiff, that is a problem. I've helped hundreds of golfers get rid of their back pain by showing them and helping them increase their range of motion in their hips and their range of motion in their upper back. So this is a quick drill, a quick test that you can do to determine, do I have limited hip internal rotation? On my right side, so if I'm a right-handed golfer, I'm going to stand on my right foot. I'm going to have my left foot on my toes next to it. I'm up tall, hands on my waist. I'm going to rotate. I'm going to make sure this foot is not pointing outward, okay? A lot of people, if you've got a little bit more of a tendency for that toeing out position, you want to correct that. You want to make sure that foot's real straight, okay? So I'm here. I'm turning to my right, like so. What I should not feel, if you feel a huge stretch and a limitation of, man, I can't really turn that way, and if it reproduces your low back pain, then we know that that hip on this side, the right hip, is limited in what's called internal rotation. So that looks a lot like the posting position in your backswing. Okay, if you can't get into that trail hip for a right-handed golfer, that low back is going to have to do more work. Same thing for your lead side. This one's even more important. They actually even have a terminology of a medical condition called hip spine syndrome, and it's very prevalent in golfers, and it's lead hip. So for a right-handed golfer like me, it's my left hip. If I can't post into that lead side, my low back is going to develop pain. So left foot, same thing. Here, hands on the waist. You're going to rotate to your left, and same thing. You should not feel a huge restriction, a huge stretch here on that outer hip. You should not feel pain in your back. This is that generalized concept that we call regional interdependence, and for golfers, it's critical. You have to be strong in certain areas. You have to be mobile and flexible in certain areas. You have to have great balance. You have to have strength. And you've got to put that all together to try to hit that little white golf ball with the head of your small golf club consistently, and it's very challenging. But if you're dealing with low back pain, give this a test, give this test a try. If it's limited, reach out to me and I'll show you some of my tips to help you increase the range of motion in your hip so your low back pain goes away.